Now, medical laboratory scientists will from this morning withdraw all their services at health facilities across the country. The action is in protest of salary discrepancies, which they say have existed for about 6 years after the introduction of the single spine pay policy. They vowed not to relent on their decision until government resolves all their grievances. They also accusing medical superintendents and directors of threatening their lives. Nancy Emefa-Dradosi was at the Korle Bu Teaching Hospital earlier today.
So we are at the Central Laboratory at the Korle Bu Teaching Hospital. Now, we do know that the Ghana Association of Medical Laboratory Scientists are on an indefinite strike action. Thus, they've withdrawn all their services to the general public nationwide. Now, we are at Korle Bu to try to speak to some of these patients. We know that if you want to get your blood tested, you want to run a lot of tests, this is the only place you would be able to do that. But now that they are off, let's find out how this is going to really have an impact on some patients. I have with me one woman. Hello. Pacho, Pacho, Bemikakra. Na waba say ene pe na waba so be test na.
Thursday me buy no mo say yenko. Yembra Friday no so me buy. Yesi holiday. To omo anya edwuma. Ene so mo say Monday no be start edwuma. Monday no so me buy omo say omo call strike. But it so be yare emergency near the number so me lab. No mo call strike. Si nipa ku no bewu. Ntia pa ban cho ommo no muntimi so mbo aye ne nsu ye ho ntoye na yare de ya mom in fact ukite scanner o be sa ho yare na wanya boafo anhwewa ya ntia pa ban cho ombo ne nsu ye ntimi mra mesa ye ho yare me das
nti said then na obetumi ayafa because we as the whole country and omo akọ strike nti said then na wo ye wakọ back so wakọ ka chom so omo nye test name awo
me call omo so omo nye omo ko strike into omo try na ban be cancer and so omo start edwuma tie pa ban cho omo no omo committee no omo ne omo nkasa ne so ye ho ntoye me do usua.
Okay, so you heard Owusu, who's also a patient. She came here to run a few tests. But test no, Wangasa also wanna say on herself, but then she's been asked to go back because they are not working today. She's been saying that she came last Thursday. She was turned away by the lab technicians. She came today to come and conduct, and they told her they are on an indefinite strike action. It's really going to have an effect on her. She thinks that it's going to cause a lot of death if this is going to persist. But let's enter into this building and find out what exactly is happening, because from here you can see that there are red bands on this door. When you enter, the place is virtually empty. Ever since we came, we've seen people trooping in and coming out with some disappointed faces. But if you go closer to the counter, where it's supposed to be report collection and specimen collection and enquiries, they are all not working. But what we do know is that for here at the Korle Bu Teaching Hospital, they are receiving, when you come and receive your report after being tested a few weeks ago, you're still going to get your test results. But what you cannot get is for you to get tested.
No, I've been here already from last week, and I came to the maternity and they asked me to come for the lab and scan. When I came here Thursday, they asked me to come Thursday, Monday. When I came, they said they don't work, so I don't know how to do because it's my time.
So basically, I'm seeing that you are due.
Yes, even I can't even do anything because it's not easy for me from house to here.
From here, where are you going to?
I don't know because they asked me to come today.
But then I've spotted a few of the lab technicians outside. Let's try and speak to some of them to find out their perspective on what is happening and to basically tell us why exactly they are embarking on this strike. Solomon, thank you very much. I've seen a lot of people trooping in, trooping out. Most of them come out with some disappointed faces. What exactly is happening and why are you on strike?
All right. Basically, we sent an information to the public that we have an intention of going on strike. We set a roadmap, but due to certain circumstances beyond our control, we have to review the roadmap to what we are seeing today. So basically, we have started a strike action from today, and all over Ghana, not only in Korle Bu, we are on strike.
This is really going to have an effect, there are consequences on patients?
Surely, it is not something we're looking up to. We have started on humanitarian grounds. We sent a roadmap thinking the authorities would attend to our needs, but we are not seeing the commitment. And that has been the posture of people in authority. So we cannot be blamed for that.
But how do you feel, Masad, now that you've seen a lot of even grown-ups, old men and old women, coming in to get treated and get turned away?
It is sad. It is sad. My personal personalities this is not something I will go for. But it comes to a time that you have to solidarize. It comes to a time that you have to firm and demand for what you want. We have sent the signal. We sent the first signal in January. We thought that they would respond to us. We postponed the action. The Director General of Ghana Health Service was seen. He even guided us as to what to do in some of our issues. We have gone back, re-strategized, sent another signal, thinking they will attend to us. So you can see that when we are in May, right? May is ending. You can see that there's no commitment.
So until government fulfills all of your demands, you're still going to be on the street?
That is it. We are not just going for any meeting and sit down with anybody who will promise us again. We want resolute things written on paper, things that can be contested in court. These are the things we are looking for. We are not coming back soon.
Thank you very much, Mr. Solomon. You're the regional secretary. So you heard Solomon, who is the regional secretary for the Ghana Association of Medical Laboratory Scientists. So that is the situation here at the Korle Bu Teaching Hospital, with patients struggling to get tested with the fear of even leading to death. Nancy Emefa-Dradosi.
Michael Amo Omari is General Secretary of the Association of Medical Laboratory Scientists. I spoke to him earlier.
The issue of policy, as we demanded 2 years ago, has not been resolved. And again, it's not that the policy will resolve all the problems, but when the policy is implemented, a major percentage of the problems will be resolved. What we are demanding now is not only salary issues. 3 things we have put forward: that there should be a directorate for medical laboratory scientists which will coordinate the affairs and activities of medical laboratory in the country. And this directorate must be headed by a certified medical laboratory practitioner. And then another issue we are asking for is that the income generated from the laboratory, a percentage must be fenced in a specific account, so that when reagents run shortage or other logistics runs out, we can easily get some from our suppliers without necessarily suspending services. And then the third issue is the wrongful placement of our technical officers and the lab assistant grade. But none of this has been done. The directorate issue that we are asking for, yes, it is part of the policy as a whole. In the policy, it is stated that there shall be established a Directorate of Health Laboratory Services at the Ministry of Health that will give administrative and technical advice for laboratory affairs. So we are saying that, okay, if you think the policy is what you don't want to implement the whole policy, just give us the directorate. Let us have our representation in the management and the policy making, so that matters concerning medical laboratory can well be championed and articulated at such meetings. We are also asking for this account, and we don't understand why people do not want us to have this simple request.
Mr. Momari, we've seen you strike previous administrations. Now this current one, we're experiencing a strike. Is it that you haven't made any progress at all over the years in these demands, speaking to the various ministries and the Ghana Health Service?
Exactly, we have not made any progress. Since the previous government, after the strike, the issue went to Labour Commission. We deliberated at the Labour Commission. It didn't get to anywhere. This new government came, the Labour Commission asked us to sit down with the government. We have had several meetings, and still there's no issue. Sometimes you wonder what the problem is, why such simple issue cannot be redressed.
At those meetings, do you come to a certain conclusion? Is it the issue of you agree to something but it's not implemented, or you're never able to agree?
Never agree on anything. You meet the recent one that we had with the Minister of Health. It was pathetic. When we met, he asked, is it anything new you are bringing, or is the same old story? We said the same old thing. He showed a man to us who is in charge of a new appointee in charge of human resource. They will have a meeting the following week, and after the meeting, they will communicate to us. They will call us so that we find an up to date. So there has not been any plan of one solution on the paper, apart from the salary. Single spine salary wrongful placement, where about somewhere in the early April, Ghana Health Service Director wrote a letter to Fair Wages and Salaries Commission asking them to correct the anomalies. Meanwhile, several letters have gone, and still Fair Wages and Salaries Commission is also adamant in resolving the problems for us. So this is the issue. Nothing had been put on paper as a way of solving this problem. The problem with the salary is not all the professionals. When you come to medical lab science, there are cadres. We have the 3 cadres in the practice. We have the biomedical scientist grade. We have the technical officer grade, and we have the laboratory assistant grade. Each one has its own scope of work. But the technical officer grade and the laboratory officer's grade, they have been placed below their analogous grades. You see, in the salary structure, when we were at the implementation, we started the implementation.
That was General Secretary of the Ghana Association of Medical Laboratory Scientists.